Hello, this is Ron Valdesari, the Deputy Assistant Secretary for Health for Infectious Diseases in the Department of Health and Human Services, and I'm here with Ms. Regan Hofmann, the Editor-in-Chief of PAWS magazine, PAWS.com, an important publication for people living with HIV/AIDS and their friends and families. And wanted to ask you, Regan, a few questions about what do you think about the meeting? What are the most important 2 or 3 issues you've heard at this meeting that you think would be of great use for your readers and your constituents?
Well, thank you very much for having me here today. Obviously, one of the big concerns is the funding crisis around the pandemic globally and our challenges both domestically in the U.S. and internationally. We have been outpaced by this disease for a long time, not only in terms of being able to put people on treatment, but being able to afford that and afford all the other aspects that we have to address to stop this pandemic. So Gates talked about it, President Clinton talked about it. It's been a central theme in many of the presentations. Everyone has been asked to work more efficiently. We're looking at new ways of funding, public-private partnerships. In the case of PEPFAR, ramping up other countries' involvements, building sustainability, whether that's in the U.S. or globally, into the programs that we're funding. Because when we eventually run out of sleds, we want these programs to continue on past when we and get us past a point of sort of crisis into sustainability, which ideally will eventually end someday when we hopefully have the cure. Which is the other exciting thread here at the conference, is the evolution in research and the science around AIDS. We've had a few very important sets of data come out. The success of the microbicide study. There's been some very exciting news on the vaccine front, and it's very critical both for an infusion of additional funding to help us look for better treatments, the vaccines and the cure, but also to keep people who are HIV positive engaged and hopeful that they're going to survive, and also to encourage people to come forward and get tested and know that accessing care and treatment is going to prolong their life and allow them to live. So those are the 2 big themes that I've seen so far.
Well, along the lines of exciting news, last week in the United States, President Obama and Secretary Sebelius from the Department of Health and Human Services announced the release of the U.S.'s first comprehensive cross-governmental HIV/AIDS strategy. And I know you were at the White House, Regan, for that important event. Can you tell us what you think in the strategy is of significance for people living with HIV/AIDS and, again, their families and friends who care for them?
Yeah. Well, first, I just want to say that it was a great experience to be part of the community as we were asked to help develop the strategy. Obviously, to have the President's support and leadership on this issue is critical and means very much. In this time of many crises, the oil spill, and we all know them, to have the President invite a large group of people living with HIV to the White House and to personally interact with the community is a big statement. The administration has really taken charge on this issue, and that's terrific. The strategy itself, at PAWS I hear a lot of different opinions. Obviously, we sit in the middle of everything. I think the prevailing wind has been that it is a very good strategy, that it is a good start. There's obviously concern that we don't have the appropriations levels that we need, but that's going to come. I think the main message that I would communicate to my audience is really the importance of the involvement of the community itself. This is a collaborative event to make this thing work. We have to have everyone working together. It's not just up to the federal government to solve the AIDS crisis in America. The community has to be a part of the equation. We can do a lot advocating for funding, for legislation that will help protect us and our rights along the way. And I think also we all have to come together to understand how to get to 2014 when hopefully healthcare reform will solve some, not all of our problems. We still are going to need Ryan White. But I think that it's a new era of collaboration, and I think that that's what's going to bring the pandemic to a halt, all of us working together.
Great. Well, I especially appreciate your reflection of how important it is for community and government to come together, because I think the bringing together that strength and wisdom and those different perspectives is absolutely essential. So as we sign off, let me remind our folks who are watching this that they should visit pause.com to learn more about Pause magazine, and also visit AIDS.gov, where you can read the National HIV/AIDS strategy and learn more about the steps the government and its partners are taking to address the AIDS epidemic in the United States. Thank you. This is Ron Valdesari signing off from the International AIDS Conference in Vienna, Austria.